Schizophrenia is often misunderstood due to misleading media portrayals that associate it with violence, despite the fact that individuals with schizophrenia are more likely to be victims than perpetrators. It is a serious mental illness that affects thoughts, emotions, and behavior, with symptoms such as delusions, hallucinations, and disorganized speech, though it is not the same as dissociative identity disorder. While there is no cure, schizophrenia can be managed with medication, therapy, and social support, allowing individuals to lead fulfilling lives. However, stigma and discrimination worsen the quality of life, making awareness and understanding crucial in reducing misconceptions and fostering a supportive society.
Hi, my name is Muhammad Teman Hakimi and I will present about problem definition and problem statement. So in our report, we state that the problem definition of schizophrenia is that the patient that having schizophrenia will having a daily life struggle that affect their thinking, emotion, and social interaction. This happen due to certain factors such as delayed diagnosis by the professionals or the family. The second one is the social stigma that was happen due to the lower quality of life and also isolation by the teenagers normally. And the third one is due to the limited mental health service that normally happen in rural area. So how we want to improve or less the amount of people that having schizophrenia is by providing early intervention towards the society or the patient itself. Next, we will move to the problem statement. On the problem statement, there are 7 problem statements that were stated in our report. The first one is what is the global prevalence of schizophrenia? The second one is what is the percentage of Malaysian population that affected by schizophrenia? The third one is what is the background or how will the background of individual influence their chance of getting schizophrenia? The fourth one is what are the economic burden associated with schizophrenia? The fifth one is what are the modern approach that used to diagnose schizophrenia patient? The sixth one is what is the early and common symptom that display by schizophrenia patient? And the final one is what are the treatment and medication that are provided to schizophrenia patient by the medical professional. So that is my part. Next, I will pass to Amone for the next part about the symptom. So thank you.
Now we're going to talk about symptoms. Psych Central details that symptoms can range in severity among individuals due to varying social and environmental factors associated with the condition. The common signs of schizophrenia may include hallucinations, delusions, disorganized thinking, catatonic behavior, difficulty with abstract thinking, concentration problems, difficulty with coherent communication, and emotional withdrawal. Now we're going to move on to diagnosis. According to Mayo Clinic, diagnosis of schizophrenia involves excluding other mental health conditions and making sure that symptoms aren't due to substance misuse, medicine, or medical conditions. And there are 3 ways of getting a diagnosis for schizophrenia. One which being physical exam, which is done to rule out other problems that could cause similar symptoms and check for any related complications. The other being test and screening, which include tests that help rule out conditions with similar symptoms and screening for alcohol and drug use. And the last being mental health evaluation, which a healthcare professional checks the mental status by noting how a person behaves, asking about moods and hallucinations, etc. This evaluation includes family and personal history.
Hi, my name is Wesley, and I'll be talking about data and statistics of schizophrenia across the world and in Malaysia. First, the World Health Organization in 2022 reported that schizophrenia affects nearly 24 million people worldwide. This number equates to 1 in 300 people worldwide and 1 in 222 people among the adult population. People with schizophrenia are 2 to 3 times more likely to die prematurely compared to the general population due to illnesses such as cardiovascular, metabolic, and infectious diseases. Schizophrenia statistics in Malaysia are limited, with only a few reports available. However, it is estimated that close to 15,000 patients sought treatment for schizophrenia in Malaysia. According to the National Mental Health Registry for Schizophrenia reports, conducted from 2003 to 2005, more than 7,000 cases were recorded. However, this report acknowledged issues such as delayed or incomplete reporting, which may have led to an underestimation of cases. Moving on, the cost of treating schizophrenia in Malaysia is significantly high. It is estimated that $100 million was spent to treat nearly 15,000 patients. To finalize, I'll be going over the background of patients of schizophrenia. Starting with ethnicity, 54% were Malay, 28% Chinese, while 9% were Indian and 9% others. In terms of employment, 70% of the registered cases were unemployed, while 15% were students. With regards to marital status, the vast majority was single, while 23% were married. In terms of substance abuse, illicit drugs such as alcohol, inhalants, opiates, cannabis, and ATS was common. And lastly, in terms of family history, 23% of recorded cases had relatives who also had schizophrenia. Thank you. That's all from me.
Now continue with medication for schizophrenia. The first one is the first generation typical antipsychotic, which include haloperidol and chlorpromazine. They are primarily block dopamine receptors. While effective in reducing positive symptoms like hallucinations and delusions, it got side effects like tremors and rigidity. The second one is the second generation atypical antipsychotics, which includes risperidone, olanzapine, and clozapine, which target both dopamine and serotonin receptors. It got lower risk of movement-related side effects. It may still cause weight gain and metabolic issues. How about support for schizophrenia? There is 4 kinds of support. First one is psychosocial interventions, which include cognitive behavioral therapies, CBT, family therapy, and social skills training. The second one is community and rehabilitation programs, which consists of supported employment and assertive community treatment, ACT. The third one is peer support and self-help groups, which can provide a sense of belonging and share experiences. The fourth kind is lifestyle and wellness programs. It encourages healthy habits such as well-balanced diet, regular exercise, and stress management techniques that can enhance overall well-being and reduce symptom severity. In conclusion, schizophrenia is a complex but manageable mental disorder that requires a combination of medication, therapy, and social support. While there is no cure, proper treatment can help individuals lead to a fulfilling life. Reducing stigma, improving mental health services, and promoting early intervention are essential to enhance well-being of those who are affected. A holistic approach ensures better outcomes and a more inclusive society.